time talking about what the goals of the group are, and also to talk some more about the scan that DJS has planned. But what we wanted to start off doing is going around and getting a sense of who else was in the room with us. Since we didn't really spend a lot of time getting to know one another the last time we joined, we kind of wanted to get a sense of what everyone's background is and what brought them to the commission and this group. So I maybe will start. So I'm Aaron Betzinger. I'm a research assistant professor at the University of Maryland, Baltimore. I am a criminologist by training, and I've been working with the Maryland Department of Juvenile Services doing research as a partner to them for almost 16 years now. A lot of that time I've done work around detention and intake. We help validate their risk assessment instruments. We also do a lot of work around evidence-based and promising practices. So we help provide continuous quality improvement. So we're basically evaluation and implementation partner to DJS and to the providers who are delivering those services around the state. I'll pass it off to Maisha.
Good morning. Thank you, Aaron. My name is Maisha Davis. I am a clinical social worker by trade and am recently hired as the Assistant Secretary for Community Resources with the Department of Juvenile Services. My background is actually in child welfare, juvenile services in terms of direct care from the private provider side, and then program administration. In child welfare, public health. I've also worked for the Maryland Association of Resources for Families and Youth, MARFI, as Deputy Director in support of advocacy for the providers who support and serve and take care of children across our state. So was very excited to join the department, to be to support it in leading and growing and building out our continuum of care or services specific to each of our regions, counties even, so that we can tailor services directly to meet the needs of children and families in community. I consider myself both a micro level social worker, so I'm a clinician, but I'm also very much a macro level social worker. So I am, have a lot of experience in working in systems and figuring out the puzzles of how systems work, and really just working to provide support and services to our kids and our families, to our communities, right? So that folks can experience health, healing, wellness, safety, in community. So I'm excited to be here. I'm your point of contact for the department, for this work group specifically, and for the commission as a whole. So yeah, and I have a little bit of insight on where we are and how we got here. So I've had the pleasure of listening to the secretary's responses and testimony and such over the past 6 weeks or so. And so I think I got a pretty good handle on that to answer questions. Thank you. I'll kick it to Ainsley.
I'm sorry. Hey, everyone. I am working with Bethany on this commission to staff the commission. I'm the assistant project manager and data analyst over at GoCap. So anything you might need, I am here for. I will kick it off to Megan.
Great, thank you. Hi, everybody. It's good to see some of you again and see some of you for the first time. I'm Megan Galloway. I am also a recent addition to the Maryland government in the Secretary's office in the Department of Human Services. So I am an interagency coordinator and liaison with the goal of focusing really on the department's work on juvenile justice. So Maisha, I'm looking forward to hopefully working with you quite a bit. It's touched on a lot of things, very much speaking my language. My background most recently was in the federal government, in the Justice Department, and then before that on Capitol Hill in the House and in the Senate as a congressional staffer. But before that, in the Wayback Machine, my training was as a clinical psychologist and as a lawyer. So did a JD PhD program with a concentration in forensic psychology. So hopefully, I'm very much looking forward to the work of this of the commission, but especially of this particular work group, and excited to be helpful however I can be. And I'll kick it over to Russell.
Good morning again, everybody. Russ Hamill. I'm a police chief over here in Laurel. I've been a police officer for 41 years. I did 36 years in Montgomery County and retired there as the interim chief. As if that wasn't enough, decided to come over here to Laurel. But I'm very blessed to be here. I'm also an attorney and teach criminal law at the University of Maryland. And I help with a local high school football program as well. So have 5 kids, so numerous tie-ins to youth across the board with teaching and helping out there and the like. I was also chief of detectives in Montgomery County for 8 years, which included our family crimes division, in which we changed the name to the Special Victims Division. And so unfortunately, a lot of work in that area, especially with child victims and the like. And glad to be here at the, I don't know why the governor appointed me. Maybe he was having a weak moment, but here I am. So, and I believe now I send it over to Bethany.
Yes, thank you, Chief Hamill. I think you have Chief Aziz to blame. I think the nominations came from chiefs and sheriffs.
He's coming off the Christmas card list. Not kidding. I'm kidding.
And I don't think you can use the word retired. That doesn't sound like retirement at all.
Well, actually, I'm just very bad at it. So that's it.
You sound like Judge Davis. Well, I'm really excited to be here with all of these very, very, very smart people, obviously, with a lot of relevant experience. I think this is like the dream team of people for this work group. Megan, I'm going to hit you up because I think it would be good for the prevention work group to hear from you too. Anyway, we're getting organized on that front. I'm Bethany. I'm the director of policy for GoCap, and along with Ainsley, we're here to provide staff support to you all. And I'll pass it to Dr. Park.
Hi, good morning. Sorry about being late. I'm visiting my parents, and my dad is 92, and he just had an emergency that he needed help with. So I apologize for being late. I'm Ms. Park, and I am part of the Association of Youth Service Bureaus. We do delinquency prevention work, and then also work with kids who may have had some contact with DJS to help kids not re-adjudicate. And we work with the whole family, and then offer a variety of ancillary services like GED, parenting classes, and other supports, educational, tutoring, mentoring, and those kinds of services to kids and their families. I have been a licensed marriage and family therapist for over 30 years and have been a director of this bureau, Greenbelt Cares, for over 20 years. So my life has been spent, and I've worked at 2 other youth service bureaus. So my career has really been youth service bureaus, and I'm very dedicated to this model of community-based diversion programs for kids, and helping kids and their families do well. So good morning. Again, I apologize for being late. Am I supposed to pass it to somebody?
I think Tanya is probably next.
Yeah.
Okay, thanks, Erin.
Thanks, Erin. Good morning, everyone. Also sorry to be a couple minutes late. My name is Tanya Schwartz, and I serve as the Director of Urgent and Acute Care at the Maryland Department of Health Behavioral Health Administration. So in our portfolio includes it's been a long morning already, includes programs related to behavioral health for people who are engaged in the criminal justice system, thinking about diversion and alternatives to incarceration, then treatment while incarcerated, and then what does reentry look like back to the community to ensure that people are getting connected to the needed behavioral health and other supports that they need as they enter the community. And so we also so Brandy James leads our work. She'll be on these work group meetings most of the time, but she's out today and she has some really great experience working in the criminal justice system in various ways, including as a crisis intervention team CIT lead in the Midshore region. So she leads our CIT work. So she'll be a really great resource. We also in our division cover 988, as you can see from my background, and all crisis services, so mobile crisis services, urgent care walk-ins, crisis stabilization. So we're doing a lot of work right now broadly across the state that hopefully I'll get a chance to share more about at some point to really expand our continuum of care across the crisis services with a particular focus on youth. And we promote and support a specific MRSS model for mobile crisis response and stabilization, and are looking to continue to support that. So again, really trying to identify ways to support our youth to prevent incarceration. And yeah, so that's a quick summary of why I'm here, but it sounds like everyone has such amazing experience. So this is really going to be a great group. So thank you. And is there anyone I'm supposed to pass it to? I think I saw everyone talk. Erin, help me out.
I think Sandy Bartlett.
Great. I will pass it to you.
Hey everyone, I'm Delegate Sandy Bartlett, representing Anne Arundel County District 32. I almost said District 33 there. District 32. And unfortunately, I'm sorry I'm late, but I'm only going to be on for about 15 more minutes because we have House session starts at 11 o'clock. Oh, I'm supposed to pass it on to someone and I have no idea who's already gone. So if you haven't gone, how about you just take it upon yourself and introduce yourself?
I think we've all gone around now. So Bethany, I think one of the things we were wanting to accomplish today is to talk about the goals of this group, but we also wanted to differentiate this group from the prevention work group. So do you want to talk about that a little bit?
Yes. So I think the question has come up, how are we kind of delineating what the prevention work group is looking at versus this work group? Because as I'm sure you have all thought, there's potentially a good amount of overlap between the services that we're providing to kids that are preventative and also rehabilitative. The way that we've been talking about it with Judge Davis and are starting to kind of put it down on paper is that the prevention work group will be kind of much further upstream. So thinking about things like the Judy centers, the Center of Hope sites that we have in Maryland, maybe doing a little bit more with what's happening in schools in terms of behavioral health in schools and other things like that. So kind of some of the things before and outside of the criminal justice system that are available to kids and also to families. So kind of looking at the programs in Maryland where kind of early childhood or kind of pre-adolescence to see what's happening and available for kids there. So kind of if this makes sense, and I'm sorry I don't have a better visual for you, what we'd like to accomplish, not this year, but at some point in the life of the commission is creating a map. In our office, kind of in the adult context, we work with counties to build sequential intercept maps. So we kind of tracing the process from, A to Z and kind of mapping out all of the different entry points that exist into the criminal justice system and before and after. And so I think it would be a new thing for the state to have it, but creating some kind of map that shows the different intervention points that we have with kids and families before, they're facing juvenile or criminal justice system contact, once they might have that contact afterwards. And so I see prevention as kind of the very beginning portion of developing that map. And rehabilitative services is kind of looking at what's happening kind of once we've had police contact or, some kind of official school action, things like that and beyond. And then, systems and processes is going to be threaded throughout that map. So that's how we're starting to talk about differentiating the two groups. And again, we still may have some, and Ansley is putting up an example of like the adult model, sequential interstep model. So we may still and likely still will run into some overlap. Like Maisha, I think it would be great to have you plugged into the prevention work group too, at least just informationally. But we can kind of, as we go along, kind of be checking in between it, and Ainsley and I'll be monitoring it just to make sure that we're not doing a lot of duplicative investigation and work.
Hi, this is Liz. So great, thank you. That was really helpful. Aaron and I were trying to, when we were talking, kind of figure out where this group fit on the continuum. And so when you talk prevention, right, they talk primary prevention, then there's secondary and tertiary. So it really sounds like the prevention group is going to focus on what they call primary prevention, which is before something's happened. How do we keep something from happening? Right? So whether that's primary prevention like vaccination, how do we keep some kid from getting sick? Or primary prevention in mental health is how do we show early signs, support families, teach good parenting, So whereas we're calling it rehabilitative, but it can get confusing because it really is then secondary and tertiary prevention, which is also then a kid who may have gotten sick or may have had a mental health or may have had contact, but how do we prevent them from further involvement? So I think that's where it gets confusing about that word prevention, is that there's kind of like 3 tiers to prevention that they talk about. And so it may be even helpful to use that language so people are really clear about they're really going to focus on primary prevention, because otherwise they may get confused too, because prevention can also mean secondary or tertiary prevention. So I don't know if that language is helpful.
That is very helpful. And, I can pick that language back. I think it makes sense just to keep it clearer.
Can we also, just for my own clarity, when you spoke, Liz, I'm hearing early intervention, I'm hearing youth diversion, at least in our language. Does that make sense? We're in that lane as well.
For this group, for rehabilitative.
Yeah.
So right, it's diversion. So a kid who may have already had contact, how do we divert them? Yeah. And then also say somebody who's been incarcerated. What rehab is happening during DJS's time with them, and then getting them back on track. That's my understanding. Aaron, is that what you think of as rehabilitative?
It is, yeah. I'm really glad we're having this conversation, because diversion it was what my question was about this work group. Are we focused on diversion? And it sounds like yes, we are here. So Bethany, do we want to now have the conversation about what some of our individual goals are for coming to this work group? And then also, Maisha, do you want to jump in and talk about what you hope this group how we can be involved in this process with the scan?
Yeah, maybe we start with Maisha, because I see she has to jump, and we can kind of hear it from everyone else.
I'm sorry that I have to jump. I appreciate you guys, everybody's time this morning. So yeah, here we are. I think the goal as a department, right, is to really get clarity on what's happening in community, right? And so many of you are in all of our jurisdictions, and have a good glimpse of what you already know is there. what's missing. So that is the purpose of the scan. As of, I think I shared with the chairs earlier this week or last week, I don't know if all the days run together, that we have, I've identified someone to come in as the continuum coordinator. This is a role funded by the JJREBP grant to lead this scan, right? And so I'll be circling back to our HR team to see where we are, but ideally we will have onboarded that person within the next 30 days. And so that person is going to work closely with myself, of course, and the leadership teams at the department and the University of Maryland to build out the plan to address and attack this scan, kind of multiple layers to it. When we talk about engaging the justice system, judges, lawyers, DAs, folks, advocates, folks in that realm, the National Institute for Criminal Justice Reform, I think is the group, Nick Jr., is going to support us in leading that scan, that part of the scan, in terms of how we engage law enforcement, the justice system in each of our states. I'm sorry, in each of our counties, rather, to kind of hear from folk exactly what they see are the challenges and the needs and the types of resources they want to be able to support kids and refer them to, right? So that is what, thanks, Bethany. I think she's gone. So I think that's part of it, right? So that's the first part. University of Maryland is going to support us in working with some HBCU partners to scan in focus groups and really engage families and youth in community to get a understanding of what they want and what they need as they see it from their very unique lens. We have to, in addition to that, we have to talk to our staff, right? These are the people in community on the ground. And so some of that I'm starting now. This month, I'm getting out to all of our regions to just have some conversations with folks. Many of our teams who are on the ground as case managers and resource specialists have been around for many, many years, right? And so they have some rich resources and ideas about what we should be doing. And so I'm interested in tapping into that right now. Also getting to know folks and being able to kind of prepare them, prime them to be boots on the ground as we build out the continuum in each of these regions. So that's happening. We also need to kind of talk to, and I think this is where I need the support of you all, providers in your communities, right? You are attached to different providers from your different lenses who provide good service, right? Who care about kids, who in some way can contribute to what we need in this space of rehabilitation, right? Early intervention, diversion. Who are they? How can we pull them together? Where are the collaboratives, the joint efforts? Where are your provider meetings? Where, how do we touch and tap into these folks? That type of information will be really helpful to get started, right? I know Liz and I talked the other day about the youth services bureaus, right? And how they have been an exceptional partner in the past in taking care of juvenile justice families and youth. We want to be able to tap into who's there now, how can we expand that? So those types of things where you have your expertise, I think is going to be helpful for me and our team to really map out the scan in a very comprehensive way. So that's kind of my glance and my ask of this group as we kind of continue to pull together and work through. We know the department is off to a good start, right? There are lots of things that have happened before I got here that the secretary jumped right on. And so we've got some good bones, starting out with expanding programming for gun violence and reduction, life coaches, clinical treatment, evidence-based practice, treatment and care for families. But that has to expand, right? We know it's very limited at this point in terms of where we are able to provide these services. So how do we better understand what the needs are across the state? And then how do we tap into those local resources who can then provide these services on a larger scale or to scale? So does that help? Does that kind of give us a starting point? No, okay, good.
Thank you. Yeah, sounds like a lifetime of work that you have ahead of you.
It does. But I think we got some energy right now, and so let's run and see how far we can get. Yeah.
And did you want to talk about the timeline, Maisha? I know that we've talked about it. I can't remember if we talked about it in this group or not, but kind of what we're hoping to see and when.
Yeah. So, Vinny said at one point to me, I want it done by, September, so that when we come back and report to the commission, before they finish their report. And we had to, excuse me, do you mean the entire state scan? And then he said, okay, that was too far. No, so the goal is not to get it done today. It's not going to happen today. It's not going to happen completely comprehensively this year, right? So timeline wise, it really is get the right people on board, and then let's get to work, right? So ideally, I think I'd love to have a plan in place as to how we map out these benchmarks, right? By before the end of the fiscal year. So by June, we've got all the partners are at the table. All the staff are in place. We, as I'd like to believe, as a work group of the larger commission, are solidified in our work, and now we are ready to pull the trigger and go no later than July 1. And even with that, I feel like that means there are things that can happen and will be happening leading up to that space and time. Like I said, just kind of getting out and meeting people and pulling in my champions right early. That's happening now, but I ideally would love to be able to begin that process in no later than July. So some of that that work is being built now. What we have to decide as kind of an implementation team is, do we attack the full state, right? Like all at once, or do we hone in on like the big five? Is what where the concentration of where our folks are, our kids are, or do we grab some low-hanging fruit first, right? Where that, there are some easy ways to ramp up, even if it's in some smaller jurisdictions. We already have some bones in place that we can ramp up there, then let's do that. So I think in the next couple of months, I'd like to kind of clarify some of those spaces so we can figure out where we are on the map and where we actually begin. Does that help? Ideally, when we come to the fall, we want to be able to share that we are moving the ball down the field, football analogy. We're getting some yardage, and not done, but certainly well into our process. That's very broad in terms of timeline, but yeah, that's what I'm thinking today. Yeah.
Great, thank you.
Yeah, I do have to jump. Are there any other questions I can answer before I go? Okay. Thanks for having me. Thanks for doing this. Thanks for being here. The next time this will be, you'll have my undivided attention. Thanks, everybody.
Thanks,
have a great
Maisha.
weekend.
Bye. Thanks, Maisha.
All right now. Bye-bye.
So maybe we should talk. So we know what the department's goal is of accomplishing this scan. Maybe we should talk about other goals that we might have for the group, and then the ways that we can contribute to the scan, or questions we might have that should be incorporated into the scan.
So really quickly, this is kind of the outline of what Judge Davis, Bethany, and I have been talking about the goals for the Rehabilitative Services Group, the different goals, tactics, and outputs. So obviously, like, we can talk about if you want to change any of these tactics or outputs, or the objectives. Those objectives like mostly come from the legislation, but for the tactics, we were mostly thinking about like listening to people in the field, coordinating with DJS, coordinating with Maisha, and then those outputs that we talked about, contributing to that map of resources, and then creating those recommendations. So I just wanted to put this up as like what we're thinking about, but obviously, like, as a group, you guys are in charge of what you believe you want, how you want to move this work forward.
That's really helpful, Ainsley. Thank you for sharing that. In terms of addressing these goals, and I see the tactics that you have up here, are there people that we need to hear from in this group? I know we had talked previously about bringing Roka in, or some others. We've obviously heard a presentation from the department already. Are there others that we should be bringing to the table and hearing from, so that we know how we can take on this goal of evaluating existing programs and services and identifying gaps?
Right, Aaron, I think that's a great question, because maybe that's like our first goal, is identifying, like, our first step towards that goal is maybe this group identifying what groups they think we should hear from, that are already doing some of this work. Like you said, Roka, youth service bureaus, obviously I'm going to promote them. I can certainly do a presentation on them. But lots of other groups, I know you are aware, like, I don't know in which communities, but there's the FFT, there's the MST happening. Those types of folks I think we need to hear from. There is also at different points along the way, right? Different services in community, like she was saying, that DJS refers people to. Some, like in Prince George's, they have a CINS program, CINS, right? The Children in Need of Supervision. And it does certain things. So it might be helpful to hear from the, like, other established CINS programs. There's the truancy prevention. We heard yesterday or Wednesday, about another pilot program for truancy. Again, how are kids who are delinquent now because they're so truant being served? So that's just off the top of my head, but maybe before the next meeting, people could submit what programs they think we need to start looking at, and then we could start to organize which groups we could invite. So that's just off the top of my head.
Delegate Bartlett.
Thanks. Thank you. Liz did a really great list, and I was going to mention YSB, so thank you for putting in that plug. One thing I think would be super helpful, and this is not a small task, but when it comes to tactics, one is to get a list of service providers, like I don't know how hard that would be to create, but for instance, we just had our briefing with DJS the other day and OPEGA when they did a program evaluation, and there are contractual groups who work with DJS. I'd like to see that list. I know that DJS, at least the secretary explained, that they're trying to do more with the interface of the people who provide the services and who are contractual or not contractual. So they're actually doing this work to be able to have that type of list themselves, with a pull down that would be someone like a Boys and Girls Club, that's not necessarily, he gave that as an example. So my point is twofold. One, I think as a rehabilitation work group, it would be helpful for us to even know who provides services, or some of the organizations, that as many of the organizations we can possibly get as a list. And then from there, I think we can choose who we need to hear from. So I like that list that Liz was running down. And I know that there are others, and like you said, that we all know perhaps others. And then from there, determine, which is, I guess, what you're saying. But I need the list to be even more exhaustive than what Liz mentioned, because I would think that the Boys and Girls would go in there, Boys and Girls Clubs would go in there, and as well as the what are they called? The interrupters. I'm calling it interrupters, but that's not what they're called. But that
Safe Streets.
Safe Streets would go in there. The competent, I'm calling it competent mentor. That's not what it's called. It's called something else.
Yeah, that part of their Thrive program, they have the kind of competent, that I can't think of the word either, but that have peer support type of folks.
Yeah. So I just kind of,
Credible Messenger.
Credible
Thank
Messenger
you, Ainsley.
Group. That's what it is. Yeah, I'm looking at my notes now. That's what I get for not looking at my notes. But I think that would be super helpful as well. I also think it would be helpful if we had it like kind of in like with like. So for instance, if all of these people only do treatment, then maybe we could hear from one, substance abuse treatment program type, or one or two. And then if these people only do, diversion programs, perhaps maybe one or two from that. But I would love to be able to hear from each category along the scale of continuum, if possible. But that may be what Maisha was just talking about with respect to the scan. And so we may not have that information readily available to us yet, but to the extent that we do, that's what I would appreciate. Thank you.
And I believe our office can definitely contact DJS and see what kind of services that they're referring to. So we can definitely send out a survey to everybody in this work group and see what kind of services they're familiar with, as well as contact DJS and try and get a list from them about what they are working with.
And so I think, oh, sorry, Delegate Bartlett.
I would appreciate that very much. And I, unfortunately, now that I've made that long monologue, I unfortunately have to go. But you all know where my heart is, and I care very much about this. So I'll look at the notes, and I'll stay in, I'll stay on track with everything. Thank you so much.
Thank you.
Thank you.
So, and I was going to say, the other question Aaron and I were, when we were talking, was about who's going to do the kind of things you just said, like send the surveys, collect the information. And so you guys are kind of assigned to these work groups to do kind of the legwork, just so individual members don't necessarily have to take on those types of tasks of sending out surveys and compiling things and that kind of thing. So I think that's helpful for us all to understand.
Yeah, we can definitely do that for you guys.
Okay.
Are there other thoughts among group members about other things other programs we'd like to hear from, or do you know of programs that your systems are working with? I know, Megan, you mentioned working with juvenile justice involved youth through your department. Do other folks have thoughts?
Yeah, and if I can just elaborate on that a little bit, and I emphasis on a little bit because I'm relatively new and sort of still getting up to speed on all of the work that DHS has done with DJS. But I think one of the goals there that dovetails with the work group is making sure that our agencies are coordinating, because there are so many dual and multi-system involved youth who are getting services from both DHS and DJS, likely also health services, but you know, that's outside of my my purview, but making sure that those folks, those kids, those dual system involved youth are not kind of getting shuttled back and forth, or that they're not getting that both systems are talking with one another. And I know that DHS and DJS had worked in the past with Georgetown on their crossover youth model. And have implemented several kind of strategies that were identified by that model as mechanisms for better collaboration. So that also might be a recommendation or an idea, I guess, for like a bucket of folks to hear from, or it doesn't necessarily need to be Georgetown, but maybe some of your fellow academics might be an appropriate kind of very high level overview of like different models that exist to address these kind of intercept points, and how to make sure that systems are not losing kids at those different points throughout the process that will be mapped out.
Great.
Yeah, I think that's a very important piece, is how do we coordinate between agencies, DHS, DJS, school system, which I know we all, think about too, like how are kids receiving the education to keep them involved in school, especially, those kids who unfortunately are charged as adults who are sitting in services for over 180 days, which I think it was Delegate Bartlett who pointed out in session the other day that that's a whole school year, 180 days. So some of those kids, if they're not engaged in school, have lost a whole school year.
Ainsley, do we have someone on this committee who's a representative from a school system?
So we're supposed to, but we haven't gotten anybody appointed yet, and it's most likely we're not going to have anybody until the end of session. Okay. So eventually we will, but for right now we do not.
All right. And then Tanya, I don't want to put you on the spot, but I know that you said Brandy James is the usual representative on this work group, but are there other programs that you're thinking of that we should bring to the table that MDH touches?
Yeah, that's a great question. Let me take that back to Brandy and just talk through it with her. I will say, Brandy and I've been here for about a year, and Brandy's new, taking on this role just in the last month. And one thing we've noticed as we've looked at our contracts with jurisdictions is that many of them are more focused on adults than youth. And so one thing we are doing right now as we look at our fiscal year 26 contracts with jurisdictions, so we contract with jurisdictions, they contract with providers, is making sure we're being explicit that these contracts can serve youth and that we want to encourage that. And so let us go back and I'll talk to Brandy, and on a future meeting, we can certainly discuss kind of what programs we do have where we think youth can be plugged in, as we're thinking about how do we do a better job of ensuring that we're serving youth in addition to adults.
Great, thank you.
So one question I also have is, while we're having this conversation on schools, if you guys are interested in hearing from or working with the juvenile services education program like that, the JSEP board for DJS, if that would be helpful at all.
I think that would be like the services being provided rehabilitatively to youth. So yeah, I don't know if others agree.
I do, yeah. Chief Hamill, we haven't heard from you. Are there ideas that you're thinking about in terms of who we should bring to the table to talk to, or programs that you're aware of that haven't been mentioned already?
So I've been sitting here thinking about, you guys have covered everything I could think of. Although there is a group in Montgomery County called Sons, and they're an intervention group of adults now that have had issues when they were juveniles, that do interdiction efforts to help steer young men, young women away from going down the wrong path. And they've been pretty successful from what I've seen. And it's out of the Department of Social Services there. And I think, this is not a shot at anybody. I think we tend to be pretty much Baltimore centric and Annapolis centric when we do things. I think it's beneficial to hear from other groups that have had success as well. I cannot remember who's in charge of social services there though right now, and this is the benefit, one of the benefits of getting older. So, but I will try to figure that out and make contact with some people I know over there. I just think it'd be beneficial to hear from different groups. I know they've had some pretty good success there.
And I can try and
No,
figure
yeah.
out who is the social services person out there as well, if that would be helpful.
Thank you. Yeah, no, I think those types of programs, again, it's kind of the credible messenger that they're doing in Baltimore City. Like, are there other programs like that, as you're saying? So somebody who has that experience in their own life and now are helping young people not make the same mistakes, helping them learn the skills they need, how to, a lot of it is conflict management or, how to de-escalate things, and then making better choices. So yeah, so finding out if there's other programs like that. I think there is one in Prince George's. I can't tell you the name of it. There was some different, there's one called Mentoring to Manhood, and some things like that. So that's an interesting one, kind of like other groups that are working with young people who may have shown some signs of difficulty, and now we're trying to keep them from entering DJS.
I think too, might be helpful to hear from a collaboration council. Montgomery County, it's collaboration council. I think I was on that for 17 or 18 years. And I know there's other collaboration councils as well. Might be
Right,
helpful to hear from.
Yeah. Some places call them local management boards. I think
Right.
Yours calls yourself the Collaboration Council. In Baltimore City, it's the Family League. So yeah, it might be helpful to hear from those entities what groups they're aware of. So that might be a part of the survey. I think would be great.
And I think too, it'd be helpful to hear from maybe out in Western Maryland and the Eastern Shore, and see,
Yes.
What's working down in Salisbury, what's working up in Cumberland, or even trying to get my bearings right west of there.
Like Carroll
just
County.
to hear.
Yeah.
Great. So we only have a few minutes left. So I think this is a really great start to a list of folks that we potentially would want to hear from or include in the survey. Ainsley, it sounds like our next steps are perhaps to send something out to this group to get more feedback, and you'll help us hub that.
Yes, for sure.
All right, awesome. Any other closing thoughts before we say goodbye today? Liz?
No, I was just going to say thank you to everybody. I appreciate everybody's taking time on a Friday morning, and coming to work on this, because it's really important work and really trying to figure out how do we support all Maryland's kids. This is a particular group that really needs some support.
Great. Yeah, thank you, everybody. And I guess we'll be seeing you soon. I can't remember off the top of my head when that next meeting is. Do you know, Ainsley?
I gotta dig.
I think she's already gone, so.
Oh, I gotta dig through my calendar, but
Oh.
I can find it.
Okay.
They'll send us an invite, I'm sure. So,
Yeah.
all right. Well, thank you, everybody. We'll see you
Thank
next time.
you.
Have a great weekend,
Bye.
everybody.
Bye.